Hey everybody, good evening. Thank you so much for being here with us on the I Care for Your Brain free lecture that we've been doing since November of last year, and we've actually crossed over into the 100 plus episode, which is really exciting. I would not be here if it was not for all of you out there wanting to learn evidence-based brain health, wanting to help me try to build a more patient-focused brain healthcare system. I need you out there being advocates based on your own experience, and you need me as a medical provider on my side advocating for better, more personalized brain health care. So my philosophy is that we need each other in order to make this dream a reality that we both have, the need, the respect of giving people personalized brain health care. So every Wednesday at 6 o'clock we meet here, and I try to give you my very best as a board certified neuropsychologist. What I love about being a neuropsychologist really is both terms. The neuro, the brain stuff, the importance of the anatomy and knowing what it does and how it's interconnected with all sorts of different functions, but also the psychology side, which is really the you, the how are you coping in the midst of a brain health challenge or crisis? How are you adapting? How are you coping? How are the people around you adapting and coping? So what we try to do is bring these two things together and talk about topics from those two perspectives. You probably know that May is Stroke Awareness Month, and we have been focused on stroke here for a while now. I did my very first podcast since I was with you all last on a really awesome show called The Neuro Nerds. And I got introduced to the Neuro Nerds because I started an Instagram account for the I Care for Your Brain program about a month ago. And that was to really try to reach other people in the communities online who are going through stroke recovery and who are surviving and thriving. And I just wanted to make sure everybody who needed this information got it. So we've been over there for about a month. So if you're an Instagram person, come on over and like us and follow us. And what I found out was there's this whole amazing, impressive grassroots movement going on Instagram of people who have had their strokes or AVMs or moya moya or anything that can go wrong in the brain. These people have started their own Instagram accounts, and they are out there advocating based on their own experiences. This is what needs to change. They're out there building community and maybe making people not feel like they're all alone. And so the host of this program, one of the hosts I was with, his name is Joe, he had a basal ganglia hemorrhage in his late 30s, and for the first year after his stroke, he was telling me that he felt really alone and lost, and he just didn't know what to do. He didn't know how to recover. He didn't know anyone else who was young like him who had had a stroke. And so he started this page with this woman, Lauren, who had a traumatic brain injury, and they are just doing so awesome. They connect with people, make them feel understood. They get different experts on their show. And so he was nice enough to host me for my very first podcast. So if you guys get a chance to listen to it, it's up right now anywhere you get podcasts, and I would appreciate it, and I think the Neuro Nerds would appreciate it. And the reason I was on the show was because we are getting really, really close to releasing the long-awaited Stroke Recovery Guide. We have been working on this for over a year and a half, and we're putting out more and more information about it, and we hope we're kind of building you into a fever so you can't take it anymore. On June 5th, you just have to get yourself a copy. And I wanted to just start off tonight by very briefly telling you a little bit more about it. So simply put, there are way too many unmet needs in the stroke recovery journey, and I felt a responsibility to do something about it. What I'm focused on is once people are discharged, once they leave the hospital, this is when people talk about falling off the cliff, not knowing what they're supposed to do, not knowing how to direct their care. And I think that is so sad because it's unnecessary. And I thought, I'm lucky enough to help people here in my practice, but it's limited. It's a one-on-one interaction, and I love it, and I would never not do it. But I thought, I can put all of my thoughts, my model of care into a book that we can get into people's hands who really need it. And then they're empowered to know what is it I need to be doing to move my recovery along in the most efficient way, the most evidence-based way, But as you guys know, we can't just focus on the brain, right? The brain, yes, is the organ of the self, but let's not forget the self is the one who's hosting the brain. And so what I wanted to do was really two things. One was to respect the fact that every stroke is different, every stroke recovery is different, and that we really needed to come up with some principles or some rules. So I went through all of the stroke recovery literature research, talked to all of my very best colleagues who work in stroke care based on my own expertise as someone who worked in an acute inpatient stroke rehabilitation center, who's seen thousands of people after a stroke, and really put together what I'm calling the top 10 rules of rehab. And what this means is if you understand these rules, that you can apply them to any post-stroke symptom and work to your very best recovery, okay? But in addition to working very hard on actual rehab and recovery and neuroplasticity and brain building and brain healing, we also have to work on the adjustment, emotional, psychological side of stroke recovery. And I'm worried that we're pushing that piece aside too much in favor of the physical and what we can see and what we can measure and what can be objective. We also have to give people really high quality tools to navigate through the psychological trauma that can come with stroke, and personalized support tools that can help them stay motivated, keep a positive attitude, work on acceptance without giving up a very strong desire and focus for the maximum recovery, and empowerment tools to help people become the most assertive advocate for their own care that they really have to be in order to get the care that everyone deserves. So it is 116 pages of my very best work, my very best efforts, and I tried to use the same approach that I come to you with every week here on Wednesday, which is a lot of facts and very important information, hopefully said in a way that's clear and understandable, but also positivity and support and bolsters for the emotional side. So it will be out on June 5th, and we're super excited. So tonight we're going to talk about the stroke care recovery team. And what do I mean by this? Well, these are a group of professionals that come together for a common cause, which is you. And I want to tell you about who should be on the ideal team. What type of professionals am I talking about? What do they actually do? And I want you to understand, this is my list. This is the ideal list that I have in my mind. Maybe I missed someone. I always try to defer to you all out there who have lived after a stroke, that really it's our two expertises that have to come together. Me as a doctor, you as a patient. You know a lot more than I'll ever know, and hopefully I know some things that you don't know based on my education and training. So feel free to chime in. Tell me if there's somebody that I'm missing. I also wanted to start off by saying I'm really presenting the ideal team. This might not be realistic for many people. Some of you don't have insurance, some of you live far away from providers, but the truth is we have to make steps towards patient-centered brain health care, and one of those ways is to speak in ideals. We have to talk about what should be, not just what is. So my idea is that patient-centered brain health care is multidisciplinary. We get expertise coming in from multiple different professionals. Has to be evidence-based. We have to know that it actually works, right? Can't be hocus pocus. And it has to be based in psychological support. We have to always be thinking about the person, not the symptoms, the person, not the brain, the recovery of all of their self, okay? So we know that 100% that this is true. Stroke recovery is very different for every person, and everyone's symptoms are very unique. Most people have overlapping symptoms. There's usually not one thing that's going wrong, and that's because every part of the brain does multiple things. And I've talked with you about this in previous lectures. There's almost always a physical function of a part of the brain, a cognitive function, and an emotional function. This is really exemplified well with the cerebellum and cerebellar injuries, is that we know it affects coordination, and because we can see the motor coordination once we get close to a target, you know, people with cerebellar issues can do pretty good when their hand is out here steady, but the closer they get to what they're trying to touch, that's when you really see the tremor. And that's what we can assess and see, and that's objective, and we can prove that. But that same coordination goes into word finding. It goes into emotional regulation. So that's a perfect example of the cerebellum gets this rap as being one part of the brain involved with movement, but really if we knew more, we would be able to validate different types of symptoms that can come from cerebellar damage. So this is why I've talked to you about the importance of your secret weapon, which is the map. The map gives you your layers, and it gives you insight and information into your unique brain injury. And so a lot of what we're going to talk about tonight with care teams is who are the people that can put you on the map, help you figure out with your specific symptom what exactly is the cause, what symptoms is it manifesting in, and really what we all care about is how can we get you closer to where you want to be going, right? It's very important to have nourishment after a stroke from all different angles. It is indisputable that organized care, professionals working together, have a much better chance of helping you than one or two people individually. The last decade, we really have seen big improvements in coordinated stroke care. Okay, so all around the world, most hospitals, significant big hospital systems, have a stroke unit, have a TIA program, have rules and regulations about who gets the clot busting medications. There are specific stroke acute rehabs. There are long-term rehabs. We didn't have protocols and guidelines up until a very short amount of time ago. Most places are operated by clinical guidelines that are rules that say this is what works and this is what we have to do to people. But what I'm talking about tonight is not what happens in the hospital. I'm talking about that leap once you get discharged and you're on your own. I'm very concerned that too many of you are hobbling together your care, and there's no reason to reinvent the wheel. That's what's so cool about these Instagram people, these awesome survivors and thrivers who are out there, and they're saying, learn from what I went through. I walked in your shoes. Let me tell you what worked for me, so you don't have to spend 6 months or a year getting on your feet. So a care team is a collection of caring professionals who have different specialties but come together for a common purpose. I said it before, it's you. They should all have expertise in stroke or at very least brain injury. They share your vision of a recovered you. They care. They want to work with you to get you as well as you can be. They should have common goals, which include wanting you to have a comprehensive and accurate assessment within their specialty bubble. They should give you realistic next step goals, help you set these goals. We need personalized treatments that are relevant to you and bring as much of your person, your hobbies, your interest into rehab therapies as possible. We need to be care planning for the whole person, right? There's many things that have happened to you before your stroke and will happen to you after your stroke. We cannot reduce someone's identity to just a stroke victim, a stroke survivor, right? You get to be your whole person in rehab. You need to be your whole person. So what we're going to talk about is who exactly these people are. So the first one, you might have guessed it, I'm starting off with, is neuropsychology, board certified neuropsychologist. We are probably the very best stroke recovery partner that you've not heard of or you've not had access to. And that's been one of my motivations to do these lectures, is to introduce you to a real neuropsychologist, because I think I'm representative of a lot of neuropsychologists out there. I think we are, smart in our own unique way, and we are very caring, and that's really what you need in a stroke recovery guide, is somebody who knows a lot but also isn't going to squawk at you and be all up here and act like you're down here because you're the patient. We really need collaborators, right? So many of you have seen neurologists, you might have even had a neurosurgeon, but I strongly believe you also need a neuropsychologist on your care team. So who are we? What do we do? We are doctors of clinical psychology. We usually do about 5 years of getting our PhD. We do a year of an internship where we work under doctors and they teach us all their important clinical skills. And then we do a 2-year fellowship, and this is where we start to move into independent practice. We then become licensed as psychologists. And really what we do is we pride ourselves on bringing a whole lot of data sources into our evaluations. We are really assessment-based psychologists. So what that means is we're interested in multiple pieces of information that help us really get a realistic understanding of the person. Too often we have specialists that are really super smart in their one thing, but sometimes this one doesn't know what this one's doing, and this one can't appreciate that maybe their insight is also related to another specialist insight. So we really pride ourselves on appreciating the full impact of stroke, from neurological to psychological to social to family. We use medical records, we use paper and pencil testing, sometimes we use computer testing, and our job is to really look at your performance, your brain's function, your brain's ability to do stuff, your coping skills, assessing for things like post-traumatic stress. Have you developed some depression after your stroke? All of these things can muddy the waters for rehab, and until you have that map and all of these pieces have been sorted out, you're kind of in the dark. You kind of don't have a compass. So I think a lot of what we do is provide answers. We fill in the gaps a lot of times on education. Many people have come to see me and they don't know where in their brain they had their stroke. They have no idea that maybe some of their big emotions that have been happening are because there's kind of an inhibitory release in their brain, and that the brake just isn't working as good as it used to, and there's not a great filter and things are coming out, and the wife's getting mad and the kids are getting their feelings hurt. But these are neurological things that we have to help people understand, or else what's the consequence is that people feel ashamed and they feel bad. But many times these things can't be helped. We can teach you how to compensate and work around it, but that's only once you've identified that that is an actual bona fide symptom. So we're really good at strengths and weaknesses. How can you use what you're still really good at, based on the truth that a stroke is a focal injury? Never forget that. Your whole brain was not affected. You have a lot of very healthy brain around that small stroke area. And a neuropsychologist can teach you how to use what's still really awesome and good to compensate for what is the new weakness. So we do a lot of talking, we do a lot of collecting of these records, and we tell you everything that we find, and then we come up with this really detailed report, but usually about an 8 to 10 page report. This is what happened. These are their symptoms. This is the test results. And most importantly, now that we know this information, this is where we can guide the patient to go next. These are the treatments they need. These are the specialists in our community that they need. We do really good follow-up plans. We don't just say, hey, see you in a year, come back for your next evaluation. We like to follow people and help support people. We do not prescribe medication unless we are in New Mexico, my second favorite state, Louisiana, and we have gone through a fellowship on psychopharmacology. So you're not going to be able to get your prescriptions from us. The next people are in the world of physicians. And in the world of physicians, there's really two people. There's neurologists and there's physiatrists. So neurologists, as you all probably know, help you really figure out the extent of the damage in the brain. Of course, they're very important care partners. They are sometimes a little bit more focused on structure of the brain as opposed to function. And so they order the MRI, they interpret the MRI, they're able to tell you, show you the picture, exactly what happened. They can test your strength, your reflexes. They're really good at helping us understand the changes that have happened in movement systems. They do a little bit of cognitive testing, but not nearly the in-depth amount that we do as neuropsychologists. They certainly are great care partners for your long-term recovery. Many people, though, have given me the feedback that because many of the neurologists are working within traditional medical systems, they don't feel like they get enough time with these doctors. And I think that's part of what many of you have told me you enjoy about these lectures. We typically go about a half hour to 45 minutes. And the whole idea here is that it's not just a blurb. It's not just quick. I think you deserve to have very in-depth information, very complex information explained to you. It's all in how we talk about it, right? And so if we describe things in terms that everyone can understand, then there's really nothing that we shouldn't be able to talk about, because if someone appreciates it on a good level, you should be able to take anybody from zero ground understanding all the way up to pretty high understanding. So these folks can give you education, they can prescribe your medications. Physiatrists are rehab doctors. These are probably the people you saw in the inpatient. They specialize in physical medicine and rehabilitation. Their job, very simply put, is to maximize your function, your potential, your ability to get better. So as an outpatient, they can oversee your whole rehab program. They can help you make the decisions about your abilities to go back to work, to drive, to return to your hobbies. The goal for them is to really help you get to the treatments that will help you reach your full potential. They do the Botox injections. They can help you with a catheter program if you need that kind of thing. Once we have the care plan, those are really the people who kind of are in charge of the big picture of your recovery treatment map. They send you to different rehab professionals or therapists. And the first ones that come to my mind are physical therapists. They specialize in treating movement disorders or movement symptoms. So they evaluate things like your strength, your stamina, your range of motion, your gait, the way you walk, and they customize individual rehab programs aimed at helping you regain control, regain sensation, coordination of your motor function. This can be an affected hand, this can be the way your whole body coordinates movement as it walks. They are really focused on recovering this physical function. One of the things that I think is really important is that they also treat the whole body. And so they're not just typically going for that one hand. They really want to get your whole body more fit, into better shape, help your cardiovascular health. Sometimes the reason we maybe had a stroke is because we were, quote, deconditioned, meaning that there was a lot more sitting than there was doing. And we have to be really strong to meet our full rehab potential after a stroke. So they really do a great job of really just helping your overall fitness level. They can do all sorts of amazing things. Physical therapy is probably one of the most exciting areas of brain science right now. There's a lot of developments coming out in terms of electrical stimulation, in terms of balance techniques, different passive range of motion exercises. I follow a lot of physical therapists on social media, and they just amaze me at how good they are at rehabbing the brain. They also can be excellent coaches. A lot of PT people either have a coaching background, interestingly, or a sports background. So they kind of have this built-in cheerleading personality, and they can really, really support you pushing yourself to the very limits. I think they're very helpful for confidence building, for self-esteem, emotional strength. Oftentimes they can kind of become, you know, in a very special category of like provider friend because you go to see them 3 times a week. Really, it's a very powerful area of rehabilitation. We call those PTs. Then we move into the OTs. These are occupational therapists. If any of you have seen an OT, you can let me know. I love OTs because they're so focused on real life and function and the application of science. There was a time where I wanted to be an OT because I just thought it was the coolest thing to help people get back into their real lives. OTs love to be very personal. They really care about your life history. They're very focused on community. They work very holistically because they're focused on real world skills. And as you're trying to figure out things like how you're going to walk, how you're going to brush your teeth, prepare your meals, go back to cross stitch, how you're going to dress yourself, emotional issues can come up, and they're really good, again, at coaching and developing your confidence and being with you in some very tender emotional times where you can feel like you're not making progress or things aren't going to get better or you see your limitations right here face to face. They're amazingly supportive. So they really can help us adapt, and they very much are there to take complex things like, let's say, returning to driving and break it down into its part. They help you practice each part, and then the whole idea is you can perform the whole sequence. So they have these great strategies of learning people how to redo complex things that are critical to getting people back into their real life. They can be really good at coming into your house and moving things around, changing physical barriers that were there before. They're very creative, ingenious people. So we have PT, OT, and now we're going to SLP. This is your speech and language pathologist. Now, the first thing I have to say is that speech people need a rebrand. Too many people don't understand what they do because speech therapy. Speech therapists are really cognitive therapists. They're swallowing specialists. They provide cognitive therapy after a stroke. So, for example, if people have aphasia after a stroke, you can have two major types. So you got your expressive aphasia, which is trouble getting it out, or your receptive aphasia, which is trouble understanding when language comes into your brain. And so they do all sorts of very important things in terms of rehearsal and practicing and compensating and learning alternative means of communicating. It's not so much about words and speaking as it is being able to get your point across, be understood, get your point of view out there, get your opinion out there. So they can even do things like communication boards, sign language. They're very much into effective and efficient communication. They're also specialists in swallowing. So some of you might have a symptom called dysphagia after a stroke, and they use imaging techniques to figure out during a swallow what exactly is going wrong. This can be a delayed reflex. This can be trouble using the tongue, coordinating the tongue. This can be you're shoving food back into the cheeks. Once the issue has been determined, then speech and language people work with you to retrain the problem, work around the problem, minimize the impact of the problem. They can make recommendations on food choices, texture of food, all that good stuff. Then we have neuro-ophthalmologists. These are eye doctors that specialize in figuring out, is a vision problem at the level of the eye or is it at the level of the brain? Many strokes result in vision issues, double vision, field cuts, neglect, cortical blindness, things that there's nothing wrong at all with the eye, with the lens, with the pupil, with the retina. It's all happening back here in the occipital lobe. And so they use very sophisticated instruments to help pinpoint where in the visual stream, which goes all the way from the eyeball all the way back, where's the breakdown and what are you going to do about it? Prisms, vision exercises, recommendations about the environment. There are not a lot of neuro-ophthalmologists out there. We in North Carolina have about 2 or 3 in our area, which is wide, that we send our patients to. So it might take you a little while to find them. The next professional that should be on an ideal care team is a social worker. I love social workers. My mom is a social worker. These are professionals that help you navigate the system and help you with your own psychological journey and support. They can help you with disability benefits. It's very important that you have someone to advocate for you within the system because so much of recovery is trying to happen within a system. I also wanted to give a shout out to recreation therapists tonight. I worked with the coolest recreation therapist when I was at UNC, and in fact, she really taught me a lot. Her name is Grace, and I know that she sometimes watches us on Facebook, and I wanted to remind her of a story of when we worked together. And there was an unfortunate young man in his 20s who was with us for about 3 months. He had a very serious brain infection and we were not sure if he was going to make it, and he had a really hard time, and she advocated for him to get an Xbox in his hospital room. And he told me in many of our therapy sessions that he thought that literally saved his life, that if he didn't have that distraction, that ability to get better at the game, that he would have just felt like his life was over. And it really connected him to feeling like he was his old self and he was back in his life. And we had some pushback from hospital because, you know, he had an infection, and what if the Xbox handles get infected? And Grace, the rec therapist, was just such a strong advocate that this was just as important as his physical therapy, just as important as his swallow therapy. And I just really love that, and that always stuck with me. So they're really there to help you work through any physical disability in terms of getting back to your leisure life, your hobbies, your interests, sports, things like that. The next person is a massage therapist. Who amongst us does not love the massage? Well, after a stroke, it's really important because you need range of motion and you want stimulation and you want oxygen and you want the blood to be moving through your body very well. There's several studies that told us that people after a stroke who have numbness or that reduced range of motion in the arm or the legs benefit and get more sensation back and mobility back after a massage. So that's very important. Massages also release feel-good chemicals in the brain, feel-good hormones like serotonin and oxytocin and all this important stuff. We cannot forget our counselors. These folks are critical. I just wish more counselors were specialists in brain disorders. It's not okay if your counselor doesn't understand stroke or doesn't understand your specific stroke, because they're not going to get you. They're not going to get what you're really struggling with. So for most people, a stroke is, of course, a neurological trauma, but also a psychological trauma. I've told you this before. We are focusing way too much on the brain and not nearly enough on the person. So their job, of course, is to really figure out your internal challenges, your internal world. Very helpful for processing trauma, adjustment issues, identity issues. Really helpful to validate that this, whatever is going on that other people can't see, is a real bona fide issue and you need support working through it. They can help you interface with your family and friends who maybe don't really get what you're going through. I wanted to also give a shout out to vocational therapists, vocational rehab. About a quarter of people who have a stroke are between the ages of 45 and 65. That's prime working time. And so for this age group, returning to work is a huge issue. Vocational rehab, think of them like career counselors. They can basically work with doctors. I work with a lot of them here in our community, and we tell them these are the kind of things this person's capable of. These are the barriers towards returning to work. Maybe they can't drive, so they set up transportation. They also have budgets a lot of times, in the US at least, to work through medical barriers. I had a patient who I told them, I think if he had 6 months of trauma-focused psychotherapy, I think he could return to work, because he could work through his social anxiety about being around people and being in crowds. And it's not a stroke symptom. It was really a psychological symptom, and they paid for him to go to therapy, so that was really nice. But maybe most important, what these people do is they inform you of your rights. And all I can speak to is America, because that's where I am. But in 1990, we passed the American with Disabilities Act, and this tells us that people with stroke have protections and rights. The law says that employers have to make reasonable accommodations for you after you acquire a disability, and stroke is no different. So I have worked with these folks to act as a mediator for what these accommodations are. I had one really wonderful guy that I worked with about a year ago who had a stroke, and his main symptom was noise sensitivity. He was very bothered by any noise in the environment. So I worked with him and the vocational rehab person to advocate for him to work in a quiet room. He wore noise canceling headphones, and his supervisors were limited in how much verbal interaction they could have with him. It sounds kind of extreme, but it allowed him to return to work. And actually over time, he became able to tolerate more and more noise, kind of by like desensitization, by being in that environment. The next people in your recovery team are, of course, your friends and family, but we do have to acknowledge some of us get really lucky in this regard, and some of us do not. Some people really step up, and some people really step out. These people can save your life. You can also feel like they don't get you, they don't understand, they accuse you of faking it, exaggerating it. It's really, really hard when people don't care to understand what's really going on with you when they can't see it. But for many people, there's excellent caregivers out there who really take on the cause of the person. They really are these amazing advocates. But at the end of the day, we have to identify who the hub of your recovery wheel is. Who is the one person that you will always have, that you can always count on? And this is you. You are at the center of your stroke recovery team. You need to be at the center. You have the most control over you. You can do a lot. Maybe not everything after a stroke, but you really can do a lot to make your attitude good, your worldview to be positive, your commitment to therapy, your pursuit of information, things like being with me here on this Facebook page, being able to say, you know, I'm not getting information where I would like to, maybe from my doctors, but wow, I've really found this great program that educates me and empowers me, and I'm going to take the time to commit to listen. It's an act of self-care, I think, to get yourself better educated. And all of you listening right now are doing exactly that. So it's really critical that we help make you stronger as an individual as you go through your stroke recovery, because like I said, at the end of the day, the person whose job it is most to be the biggest cheerleader is you. And I know that that's very hard sometimes, but it's a goal to keep striving for, to keep going back to. So that is everything I had for you all tonight. I thank you so much for being here. It's a really exciting time around here. We're getting the stroke guide out to some key people ahead of time, and every person who has reached out has just been so supportive and so enthusiastic. I think a big part of it is that there's not been anything like this out on the market yet. There's really a attempt here to give both very high level information and also this psychological support. And bringing those two things together was really my goal. So to get the feedback from people that we kind of hit it out of the park is making us feel really pretty good around here. So we're really excited to get it into your hands June 5th. I'll be talking a little bit more about it this week. The next lecture I'm going to do is on stem cell therapy after a stroke. I honestly don't know a ton about it, so I'm going to do all my research for you. And really what I'm going to try to figure out, is it hype or is it hope? Is this something you should know about? Is this something you should pursue? Or is this something that you shouldn't waste your time or money? So thank you guys all so much for being here with me. If you are an Instagrammer, go over there and follow us there. I just am so thrilled to be with you all and appreciate you all being such good listeners very much. I will see you next time. Bye-bye.